Welcome to Fast Keto. I'm your host, Ketogenic Girl. Did you know that you actually have the option to either be a sugar burner or a fat burner? It's called having a metabolic advantage, as Dr. Ben Beekman would put it. You can actually burn your own stored body fat for fuel. On this show, we talk about ketogenesis, fasting, biohacking, all with the goal of optimal body composition for longevity and having the highest possible quality of life. I hope you enjoy these interviews and solo casts that I present to you, all with this goal in mind. Hey guys, welcome back to Fast Keto. I am so pumped about today's episode. It is with one of our favorite doctors here, Dr. Ken Berry. And I know you probably know him well if you're in the low carb or keto space. If you haven't heard of him before, you are in for a treat. He is a fantastic, very passionate and dedicated MD. He's a family physician and now author of the book Lies My Doctor Told Me. And he is from Tennessee. He has been practicing as an MD in rural Tennessee for over a decade and is board certified in family medicine. He's seen over 20,000 patients, and he's very uniquely qualified to be writing about both acute and chronic diseases. And he does a keto diet for himself, a very, very low carb, pretty much carnivore diet for himself that he has been doing keto for several years now and has just continued to focus more and more on eating more of the sort of, he calls, fatty meat diet with some vegetables and low starch greens. And I know that we had a fantastic time talking about his mission to turn the tide on the epidemic of type 2 diabetes, chronic inflammation, and dementia in North America. So I hope you enjoyed today's episode with Dr. Ken Berry. And if you want more of myself and Dr. Berry, you can go back and listen to the first episode that he was on Fast Keto last summer, and I'll put a link in the show notes to that as well. So I hope you enjoyed today's episode with Dr. Ken Berry. Now, with that goal of having optimal quality of life in mind, and I define quality of life by the absolute amount of joy that you feel experiencing life, I created something called the 20-Day Ketogenic Girl Challenge. It's the best product that I could possibly create in order to help as many people as possible try keto out for themselves, get into nutritional ketosis or ketogenesis, and become fat fueled. So whether you're in it for weight loss, fat loss, optimizing your body composition, or just improving your overall energy, your mood, your health, I know I personally have never been happier in my entire life or feeling better in my body. And so much of that comes from being at my optimal goal. I have the highest quality of life for myself that I could have ever imagined because I'm at my ideal body composition. I am living my best life in this body, and I'm making the most of being in this body. So that's why I created the 20-Day Challenge, and it's a program that comes with my meal plans, which are 4 weeks, about 28 days of meal plans. And in there you have shopping lists, full guide to getting into ketosis, testing for ketosis, which is optional if you want to do that. But the coolest thing about it is it also comes with my unlimited support and coaching. So I added this in after I had first created the program because I realized that so many of us have questions when we're starting out a brand new way of life, a new lifestyle. Not only do we have lots of questions, but we also need to have a lot of support. And so I created the 20-Day Challenge because we have a community in there of others who've done the program already, who've gone through it and love being there, love helping out and supporting other people who are joining. And then I'm also there answering your common questions. I would love to have you join the challenge, give it a try. There are other options too that can be added on and layered on during the program. I have my phase 2 higher protein plans if you're looking to build more muscle after you've started keto with the 28-day ones. I have build your day ones, no cook plans. I have vegetarian ones. I have all kinds of different versions and add-ons for later on if you decide that you are continuing at this. But what have you got to lose other than stored body fat? Use it for fuel, optimize your health and your body composition today, and go check out the 28-day Ketogenic Girl Challenge at ketogenicgirl.com. Now, onto our show. Hey guys, welcome back to Fast Keto. I'm so excited to have a very special guest joining us here on the podcast again today. This is his second appearance on Fast Keto, and this is Dr. Ken Berry. And if you are at all in the low carb or keto space, you probably know Dr. Berry very well because he is great at doing very passionate rants about keto and low carb, and you can tell how dedicated he is to this cause. Welcome, Dr. Berry.
Hello.
How are you this morning?
Hey, I'm great. How's it going?
It's going really well. How are things going with your book launch?
Well, so far so good. We've bumped up quite a bit in the Amazon ratings and on the Barnes and Noble ratings, and we're very happy about that. And I'm just glad that people are finding the book useful.
That's amazing. Now, I didn't realize that Dr. Fetke was also, he wrote the foreword for your book?
Yeah, he was gracious enough to write the foreword for the book. He and I are both contrarians and iconoclasts, and we've kind of become friends on Twitter. And he accepted, and so yeah, I'm very honored that Dr. Gary Fetke would write the foreword for me.
Yeah, that's fantastic. I just recently had the pleasure and honor of meeting him at a conference in the fall, and him and his wife are just both amazing humans. So that's really cool that he wrote the foreword for it. I'm glad to hear the sales are going so well and the rankings that you mentioned. And it's fantastic because I was saying in your intro, you know, most people probably know you as being a very passionate and dedicated MD, and I have no doubt that that comes across quite a bit in your book as well.
I hope so.
Yeah. Now, how has keto personally changed your life?
Well, I would say that the ketogenic way of eating has basically erased chronic inflammation and chronic stiffness and chronic pain from my life. I can remember very well back when I was 30 years old. Every morning I got up out of bed like an old man. I had chronic severe heartburn every day, dandruff that no shampoo would get rid of, allergies, runny nose, sinus congestion, skin irritation, rashes. Everything was inflamed. Everything was not happy. And I didn't know it back then because I thought I was a really smart doctor, but I was poisoning my own body and my own mind by the crappy food that I was putting in my body. And so really, diet has just given me back a life that I'm not in constant pain, inflammation, and chronic obesity.
Yeah, I mean, you can tell when someone is passionate, a lot of times it's because it's also affected their own lives. And I know being an MD, you're already passionate about health and medicine, but it's really cool to always connect, you know, the dots and, you know, how did you get here today? And, you know, sort of what was your own personal journey? Because I'm sure that's inspiring for a lot of your patients too.
I sure hope so. If I hadn't had the personal success with the low carb ketogenic way of eating, then I definitely wouldn't be sharing it with my patients and recommending it to them. I think any doctor should always try out the treatment on himself first. I think that used to be the case, but so many doctors today just want to prescribe the latest billion-dollar pill, and they don't really care about the long-term health and improvement of their patients.
Now, what is it, do you think, that made you different from other physicians out there that you wanted to try it out for yourself?
I'm not quite sure. I just remember thinking back again when I was in my mid to late 30s, you know, this sucks. Because I had went into medicine kind of to really help people, to change people's lives, to make people drastically better. And nothing that I was doing during my first few years of medical practice was doing that. I would put them on the latest pills and injections that the drug representative had told me about. I would go to all the conferences. I would listen to all the continuing medical education. And all I saw was that on average, my patients kept getting sicker and fatter and more inflamed, and they were on more and more medication. And that's not really what I signed up for. Putting somebody on a medication that cost, $200 a month, that's going to give them a 1% decreased risk of some bad thing happening to them in 20 years, that's not really very exciting. You see what I'm saying? I'm like, yeah, this is boring and this is stupid, and I'm not having any fun doing this because this is not what I had imagined being a doctor was about, was managing tiny risk factors. I wanted to change people's lives. And so when I got fat and inflamed and miserable and then was able to fix that, I thought, hey, this is what I've been looking for. I can actually recommend this diet and help people fine tune and tweak this diet, and I can get those almost miraculous results that I was, I used to dream about as a pre-medical student.
Now, do you think we're seeing any progress in changing the landscape in terms of having more low carb information available and, the standard of care presented as options to patients?
Absolutely. The American Diabetes Association, which is the de facto lead organization in the world for diabetes, just came out with their update, and they now offer a low carb option as a way to manage diabetes. They still won't say reverse or cure, but they'll say you can manage your type 2 diabetes with a low carbohydrate diet, which is a huge step in the right direction. I didn't predict that we seeing that change for another 5 years. So I'm surprised, and I'm pleasantly surprised that they obviously have been listening to me and Dr. Fettke and Dr. Noakes and Dr. Naiman on Twitter and Dr. Fung. They've been listening and they've been watching, and I think that they've realized that, yeah, we need to offer this as a viable option for people, or we're going to be open to a class action lawsuit or worse, because telling type 2 diabetic to eat lots of carbohydrates, the average day of eating recommended by the ADA in the past would have about 300 grams of carbohydrates, many of which would be very immediate release, high glycemic index carbohydrates that there's just no doubt spike the poor patient's blood sugars all day long and lead to worse health outcomes. And I think that in the behind the scenes at the American Diabetes Association, there have been some intense discussions, and they see the writing on the wall. Low carb is here. It's here to stay. It's actually saving diabetics from early complications. It's actually reversing type 2 diabetes, and it is the way to go. So I predict each year when their guidelines come out that low carb will play a bigger and a bigger role. And if they have any common sense whatsoever, that's what will happen.
I was also surprised to see it, happening kind of sooner than I would have thought as well. Do you think that it might influence the standard of care of other conditions and, just metabolic syndrome? And it's kind of this nebulous thing that, we try to define. Do you think it could have positive influence there as well?
Yeah, I think it will. Now, the timeline will differ for differing specialties, because in medicine in the U.S., each different specialty kind of has its own fiefdom, and they don't really like to be told what to do by other specialties. And they don't really read outside of their specialty, which is a huge thing I talk about in the book. Yeah, a good doctor should read outside of their specialty. For instance, I'm family medicine. But if I were to just read the family medicine journals and literature and ignore everything else, I would be doing my patients a disservice. I need to read in gynecology. I need to read in obstetrics. I need to read in orthopedics. I need to read in dermatology, definitely. And so many dermatologists don't realize they need to be reading in other specialties as well. And I think that goes for every specialty. And so I think that there will be individual doctors who will quickly come on board. For instance, there are fertility doctors who tend to be OBGYNs. They are quickly realizing that their success rate of getting a woman pregnant skyrockets when that woman eats low carb. And so the fertility clinics are quickly implementing this because their bottom line depends on them having a high fertilization rate, right? And so you can see how it's in their best interest to get as many women pregnant for as little money as possible, because that makes their reputation in the community. So they're coming on board very quickly. It looks like right now the three specialties that are the slowest to jump on board are endocrinology, who you would think would be in the vanguard, but definitely are not at this time. Gynecology, with PCOS, that is the treatment for PCOS. There is no pill, there is no injection that improves PCOS symptoms quicker than a low carb diet. And then dermatology, it's like they think that the only thing you can do for the skin is rub something on it, a cream, a lotion, a prescription topical. They just can't fathom the fact that human skin is literally made of what that person has eaten over the last 3 to 6 months. And if that's crap, high carb garbage, then they're going to have bad skin and they're going to have rashes and they're going to sunburn easier. But these three specialties just don't seem to get it. But I'm not going to give up. I'm going to keep yelling at them on Twitter, and hopefully we can get them on board.
That's fantastic. So I'd love to get an update from you on how things are going with your clinic. I was really, alarmed to see what happened, and I hope everything is going okay with you guys. And I know you guys are pregnant too, so that must have been a pretty stressful thing.
Yeah, it was very stressful. Actually, all the fire investigation is finished now. They've determined that it was act of God, undetermined cause. And so now we're for the insurance bean counters to count all of my beans and decide, when and how much, that kind of stuff. And so I've never had this happen before, so I have no idea the timeline, but I suspect it'll be months before I'm able to practice again. I have full intentions of rebuilding the clinic bigger and better than ever before, and it's just going to take a while for that to happen.
Yeah, I was really, really sorry to hear that, and just really not good timing, stress-wise for something like that. But I'm excited for you guys. And how's Nisha doing?
She's doing very well. She's about 15 weeks along with her pregnancy. We actually have an appointment today to go to the midwife, and I think we're going to try to see if we can find out what the gender is, and then we may or may not tell you guys. I don't know yet. Depends. And we're very excited about that, and we're very excited about the book. It's like right now our life is just this weird, unique mix of very, very bad and very, very good, all mixed together, which I guess is life in general.
Yeah, pretty much. That's a great summary of how it tends to go. Now, I'm curious, how has your keto diet changed over the years? And I would love to know as well if you guys are sort of, if Nisha's, I don't know if she has continued to do kind of a low carb approach. I'd imagine that she has, but I've also heard lots of different things from friends who've gotten pregnant while they've been keto, and sort of some of them having a lot of aversion to protein because of, I think, potential parasites, or I don't know what. I've seen all kinds of different reactions, so I'd love to see how you guys are kind of doing keto as a family.
Yeah, it's very interesting what has happened to Nisha's taste buds during the first trimester. She has definitely low carb by the modern medical standards. We read a great book by Lily Nichols. She's a registered dietitian, and she's actually been through a pregnancy low carb, and she recommends that. And so we had full intentions of doing a low carb pregnancy if Nisha could tolerate it, because I think that is the proper human diet for a pregnant woman. I don't think that there's any need 300 or 400 grams of carbohydrates every day, like the American College of Obstetrics and Gynecology recommends. I just don't think that's necessary. I think that increases your risk of gestational diabetes. It increases your risk of having a very high birth weight baby, which could lead to cesarean and other complications. I just think that it is the proper way for a pregnant woman to eat. And so Nisha's probably eating about 100 grams total of carbohydrate a day. She's trying to keep it as keto-friendly carbs as possible, but she just lost her taste for red meat. And, this girl could eat her brisket before the pregnancy, and now she just doesn't want red meat. She can barely stand to smell it cooking in the kitchen. And so she's replaced that with seafood, with a lot of chicken legs and chicken thighs with the skin on, and we're having to broil and grill and bake, because if I fry any kind of meat, the smell just drives her out of the house. And we're hoping that that's about to subside. It's actually started to get better already. And so, yeah, we have full intentions of her being low carb, if not keto, during the entire pregnancy, and then also while she's breastfeeding as well. And she is getting some YouTube videos for her channel prepared, talking about that and her journey and how she's doing low carb in the first trimester. So that should be coming soon. The way my ketogenic diet has changed over the years, just continue to notice that as I cut the carbohydrates more and more, I feel better and better. And so for the last year, I have been 98 or 99% carnivore. And so I just eat as much fatty red meat as I can hold. And every now and then I'll eat one of Nisha's Brussels sprouts. And that diet, I feel
just the
yeah,
one.
just I'll just grab one off her plate every now and then. But I just don't. I've lost. I'll tell you,
Yeah.
carnivore, which I consider to be a subset of the ketogenic way of eating. Keto is low carb.
Absolutely.
Carnivore is virtually zero carb. There may be 1 or 2 grams a day you get in there from the glycogen in the muscle and other things, but it's essentially zero carb or ultra low carb. And I have lost weight again, another 7 pounds being carnivore. I feel like it's easier to put on muscle with very little work in the gym. I think if you want huge muscles, you're going to have to work out hard. But if you just want to look lean and fit, then I think carnivore is the proper human diet for many, many people on this planet. But that's what my keto's done over the last few years. I've just continued to cut more and more carbohydrates out. I don't miss them at all. And I just feel like I'm even healthier now at 50 than I was in my 40s. And it's kind of an amazing superpower to not be feeling older as you're getting older.
Yeah, I couldn't agree more when it comes to the definition of, the process known as ketogenesis. It's really defined by the presence of ketones, and, it's the control of starches and carbohydrates that really, creates the conditions for that in the body. So I absolutely agree that, carnivore is a subset. It's part of a ketogenic diet. It is a ketogenic diet. If the lower carb you have, the more likely your body's going to be in a, state of ketogenesis or being fat fueled. So I definitely concur there. Now, why do you think people get so alarmed when we talk about removing, plant foods or phytonutrients? Is it kind of mental conditioning?
Yeah, I think a lot of it's mental conditioning, and I think it's a kind of a law of human nature that we think what is normal is what we grew up in and what our mom and dad taught us. That to us becomes, you can just imagine 50,000 years ago living in the jungle or the savannah, you had to learn everything your mom and dad had to teach or you would die. And so we're very good at that stuff. And it's like, the average Methodist has Methodist parents. And a lot of people like to think that they made an independent choice to be Methodist. But the fact of the matter is that they had an 80% chance of being Methodist because their parents were Methodist. And that goes for smokers. Even though children of smokers hate that their parents smoke, they're still very, very likely to smoke themselves because of this hardwired ability of human children to just see what their parents do, and no matter how stupid it is, to consider that normal and to grow up and do that themselves. And so I think so many of us grew up thinking that whole wheat and orange juice and all these dumb things were normal because that's what we saw in our own kitchen table every morning, and that's what we saw on every television commercial. And so this has been a huge paradigm shift for many, many people to basically you have to look in the mirror and admit, like I did all those years ago, everything that you thought you knew about the care and feeding of a human being is absolutely wrong. And when people say out looking in the mirror, then they can say, okay, well, I need to re-examine everything then. Maybe oatmeal's not good for me. Maybe whole wheat's not good for me. Maybe fresh squeezed, non-GMO, organic, locally picked orange juice is not good for me. And when you start thinking about things like that, then it opens up this whole world of, well, what is the proper human diet? What is that? What does that mean? And then you get to start playing around and tweaking and experimenting with your own diet. And it's a very fun place to be because once you're low carb for a few months, you remove so much of the inflammation from your body that when you do an experiment, like I'm going to remove all nuts out of my diet for a month and see what happens. If that is going to make a meaningful change in your health, you can feel that. Your body gives you feedback. But if you're still eating the stupid American diet, you're so inflamed, so swollen, so sick, so mentally foggy, you can't get any feedback from your body in any meaningful way.
Yeah, that's a really, really valid point. Now, why do you think that when people make the transition or try low carb, that, they oftentimes have kind of an unpleasant experience? And what are things that you like to advise people when they're beginners to keto, tips and things that make the transition easier for them to reducing carbs?
I'm glad you asked this question. So let's play a game. Let's pretend that you, Vanessa, are a raging alcoholic. Okay. Now, if
Mm-hmm.
I lock you in my barn and I take the vodka away from you and start giving you good, whole, real human food to eat and water to drink, how are you going to feel over the next 2 weeks? Terrible. You're going to be miserable. You're gonna have headaches. You're gonna have nausea. You're gonna have fatigue. You're gonna have mental fogginess. You're gonna have all these joint pain, muscle pain. You're not gonna be able to sleep a wink. So, should we call that the real food flu, or should we call that alcohol withdrawal? And so, I think a lot of
Mm-hmm.
people, they
Mm-hmm.
really need to think about the words they use to describe things, because when somebody stops eating the standard American diet and all the carbohydrates that they're addicted to, and they start eating a real whole food ketogenic diet, very often they will go through a period of a week to 3 weeks of carbohydrate withdrawal. That's what that is, not the
Mm-hmm.
keto flu. And I think we all as a community need to stop saying that term because it makes keto sound somehow bad. And it's not, because what you're
I agree.
removing the slow poisons of sugars and grains and industrial seed oils from this person's diet. They are addicted to the sugars and to the grains, and so they're going to withdraw from that. And so some people can come off alcohol, and it's pretty easy. Other people, they feel like they're going to die. And I think that's the same way
Yeah.
carbohydrate withdrawal. And I think that's really the terminology we should use. Now, often when you're coming off the
Yeah.
carbohydrates, your insulin level will decrease, and this will cause a diuresis, or you'll pee out a lot of extra fluid that you were holding from the chronically high insulin and from the chronically high levels of inflammation. And with that will go a lot of your electrolytes, because that's how the human kidney works. And so, really, the only thing I think people need to be aware of is to make sure they're getting plenty of sodium, plenty of potassium, plenty of chloride, and plenty of magnesium, then just bite the bullet and go through your carbohydrate withdrawal. And on the other side of that is a mental clarity and a freedom from disease and suffering that you might never have dreamed was possible.
Hmm. Yeah, you'll notice I didn't use the words keto
Yes,
flu
thank you for that.
when I asked you, because I don't like the term either. And I really think that, I didn't really experience much keto flu. I think personally it's just because I did it so gradually over so many years and very slowly. But I also think that maintaining electrolytes and keeping the electrolytes balanced is such a game changer. So I'd love if you could talk a little bit more on that, and what do you recommend people do to not only maintain but keep them balanced?
And with respect to what? The electrolytes?
Yeah, I mean, I think that, like you said, a lot of that discomfort during that withdrawal phase can come from this depletion in electrolytes, and they're so important for so much of our body function, especially the ions that we need just for,
Mm.
muscle actions and that potentials to fire. And there's so much more to sodium, especially to calcium, to magnesium, than we even understand. There's so much to it and what goes on in all these metabolic processes in the body. So I'm really curious, what is the best way, in your opinion, for people to supplement electrolytes and, maintain a good level of them when they're doing low carb?
Yeah, I think there's multiple ways that you can supplement them. My current favorite way is an electrolyte drop that is made by a company called Keto Chow. I'm not a paid for them.
Mm-hmm.
I just love their product. They're based in Salt Lake, and
Mm-hmm.
it has the physiologically appropriate ratios of sodium, magnesium, potassium, chloride. And so they have an electrolyte drop, and they also have a fasting drop that has a little more sodium. But I love it because every cup of coffee that you drink, if you've ever listened to my friend Dr. James D. Nicolantonio, you lose a lot of salt. And salt is vital for the proper health and maintenance of a mammal. We're mammals. And so if anybody out there listening is a hunter, they know that animals will walk for miles to lick a certain mud or a certain rock that has a high salt content. And these mammals do that not
Mm-hmm.
because they're gluttons, not because they're stupid. They do that because not because they're addicted to salt. They do it because salt is necessary for mammalian life. If you don't get enough salt, and sodium and
Mm-hmm.
chloride here, you will have fatigue, you will have mental cloudiness, you will just feel terrible. You can have aches and pains. And so,
Mm-hmm.
so many people out there, again, going back to that, what is normal? They've been raised their entire life to believe that anytime you can cut some salt out of your diet, that's a very good thing. And that's just absolutely a myth. It's a lie. It's not true. Salt is mandatory for a healthy mammal to function properly. And most of the people, even people with heart failure, need more salt, not less salt. And so I love the book, The Salt Fix by my friend Dr. D. And I love the Keto Chow electrolyte drops. And that it's just so easy and they're very affordable. They're not expensive at all. And so, yes, you definitely could get cream of tartar. You could get new salt or light salt. And then you could just get a good unprocessed ancient sea salt like Redmond's Real Salt to keep your salt, your sodium, your chloride, magnesium, potassium up to where they need to be. I really don't want people saying, oh, that's what keto flu is you're just low on electrolytes and low on minerals. I don't think that's true at all. I think that might lead to some muscle cramps, muscle spasms, and a little bit of the problem that you go through with carbohydrate withdrawal. But I think 95% of the symptoms are you're
Right.
going through a phase of withdrawal from something you were addicted to, and that's going to suck.
Yeah. That's a really good point, and there's kind of multiple levels to it as well, like physiological addiction. Then there's also the mental side of it and habits and all that. So it's quite it's quite a lot to do at one time. Do you recommend that people kind of go off carbs gradually, or just to make it easier for them, or what do you like to recommend to people when they're coming to you and saying, Dr. Barry, I want to try keto or low carb?
Yeah, that's a very valid question. And I actually was discussing that on a YouTube video I posted yesterday about sugar addiction. And really, it depends what
Mm,
style you live, what kind of person you are. There is a certain percentage of people out there who are cold turkey type people, which means if they're going to stop a habit, they have to
mm.
go all in 100%, clean out the kitchen, clean out the car, tell all their relatives, hey, I am low carb now. Do not bring me cake or pie or I will slap you. And they have to go, right? They have to go all in like that because that's their personality, that's their lifestyle. Other people, and those people might suffer more withdrawal symptoms by doing it that way. I do not think there is any danger whatsoever from stopping carbohydrates cold turkey. I think it's completely safe and natural, but the symptoms may suck for a few days. The other strategy I talk about is
Mm,
that you may want to set up a 2 week or a 1 month or even a 3 month wean down schedule. And I've had a lot of luck with people who smoke who just can't quit cold turkey. And so rather than have them try to quit cold turkey, we'll sit down together as doctor and patient. We'll write out a 1 month wean down schedule. A pack of cigarettes has 20 cigarettes in it. And so currently you're smoking 20 a day. So let's go to 17 cigarettes a day for 3 days. And then each 3 days, we're going to knock off 3 more cigarettes. And then some people have to have a wean down schedule that's even more lenient than that, or they'll just fail and they're going to fail. And, we ultimately, the goal is to not be a smoker. Ultimately, the goal is to be eating a low carb diet. So I think you need to know yourself and know your family situation and know your social situation and then decide if I can go cold turkey on carbs, I'm going to do it. But if there's just no way that's going to work with my wife or my husband or my job or my kids, then I think it's perfectly reasonable and it makes logical sense to slowly decrease the amount of carbohydrates you eat over the next month or 2 or 3.
So I want to tell you about a brand new company that I just found out about called eMeals. What they do is offer a service that makes it a little bit easier to follow any kind of lifestyle. They've been doing it with paleo for a while and with other kinds of diet and lifestyle, and they just launched a brand new one for keto. So what they do is they have a keto plan which includes dietitian approved meals and targets the right macros for you. And the meals are easy to make and taste amazing. What happens is each week you get 7 dinners, 1 breakfast, 1 lunch, and 1 dessert. And that connects directly to a smart shopping list with online grocery pickup and delivery options. And that saves you time and money. So the meal plan directly connects to the shopping list, and you can go through this app that they have and pick out meals that you like, recipes you like, kind of customize and build your meal for the week. And it will take that, send it to your local grocery that does deliveries, and the groceries will show up at your door. And then you have the recipes in the app that you can make meals from during the week. So I think they offer a really great service. It really enables you to save time and money because of being directly connected to your local grocery store with this smart shopping list. It's a subscription-based app, and you also get access to other bonus collections of keto recipes from different keto authors and other influencers in the space that specialize in the keto space. 4-week keto is all you really need to maintain a ketogenic diet on their easy-to-use platform. So go to emeals.com/keto today, and you'll get a 14-day trial if you want to test them out. That's emeals.com/keto, and check them out. Let me know if you like the service, what you think of it. If it's something that you found helpful for you, I would love to know. So be sure to go check them out. I definitely recommend this as a fantastic app and service. That's a really great approach. I read that there's 2 types of people when it comes to that kind of thing, abstainers and moderators. And if you are an abstainer, it's just best to go cold turkey 100%. But if you have a moderator mindset, it'll drive you crazy if someone says you can never have any of this ever
Exactly
again.
right.
So there's like this. Yeah, it's just like it's not even going to be approachable.
Exactly. And if you don't know which type of person you are, to the listeners out there, ask your spouse. They'll be happy to tell you. And I guarantee they know which type you are. You may or may not know, and I'm not being funny. I'm being real here. Some people just don't know which they are, but your spouse will know, and they will let you know immediately if you ask.
That's great. Now, I get a lot of the similar questions, and I like to sort of address some of them with you because they tend to repeat a lot, and I'm curious why you think that might be. One of them has to do with dry skin, and I noticed that you yourself mentioned that you had some skin issues and dandruff, and that was related to inflammation. So if someone is experiencing dry skin, or I'm sure you see a lot of questions about it, why do you think that could be on a low carb or keto diet? Because there's lots of different ways to do keto or low carb, but I'm curious as to your opinion on that.
Yeah. What I noticed in my personal journey was that my dandruff went completely away with low carb. And I have rosacea, but I have not had the first hint of redness, which is basically a redness over the face and the nose. And then if it gets severe enough, you can actually have disfigurement of the nose and large blood vessels in the face. If anybody remembers the old black and white comedian W.C. Fields and his huge nose, he had rosacea. That's what it ultimately leads to if it just continues to stay inflamed every day of your life. Me and other people that I know with rosacea, the symptoms completely go away. Basically, rosacea is a carbohydrate allergy, is what it is. And for many people, eczema, both for your baby and for you, is a carbohydrate allergy, or it's an industrial seed oil allergy. When you remove those things, the eczema just goes away like magic. For many, many people, heartburn. For many people, dandruff. All these things are just carbohydrate allergies or industrial seed oil allergies. And I think the more we come to think of keto as natural, because being in ketosis is a natural physiological state. It would kind of be like, we have to breathe anywhere from 14 to 20 times every minute. What if we started, saying, "Oh, I'm an oxygenated human"? Well, yeah, we all are. We'll die. But if you describe yourself like that, that's kind of redundant. And so I think calling the diet eat a ketogenic diet is redundant in that same way. But we're stumbling and fumbling and coming back to this ancient knowledge, at different speeds. And so I think ultimately what we'll call the ketogenic diet is the proper human diet. And then when we're calling it the proper human diet, it'll make all these questions kind of silly. And so when someone says, "Hey, if I had my gallbladder out, can I eat the proper human?" Oh, never mind. Yeah, that's the question. And I think that you see my point, and it'll also be like, "Wait, I've got dandruff. Can I eat the proper?" Oh, yeah, never mind. All of these questions will then become silly once our paradigm has shifted 100% from the terribly erroneous place it was before to the proper place, which is a low carb diet filled with whole single ingredient foods is the proper human diet. Then nobody will have that question because they'll be like, "Duh, yeah, dude, you need to breathe and you need to eat the proper human diet or you're going to die. Duh." But I think a lot of people are at different points in their journey. Their paradigm has shifted different degrees. And so that question means a lot to them. I've started eating keto and this has happened. Is that okay? Whereas if you said, I've broke my carbohydrate addiction and I'm now eating the proper human diet, do you think it's causing? No, of course not. It's not. There's something else going on. You've still got a hidden source of carbohydrates in your diet. You've still got a hidden source of industrial seed oils. And I was just talking to someone today, and they were eating a lot of meat skins, which I think is fine, but they didn't realize the meat skins are not fried in lard, which would make perfect sense. They're fried in canola oil. And so they were still getting a supply of canola oil every day in their diet. So they're going to cut that out, and they're hoping that's going to lead to resolution of the symptoms we were discussing. I think there's something hidden in your diet or in your lifestyle that you still need to work on if you're having a specific symptom on keto.
Yeah, that makes a lot of sense. And it makes sense why, certain people who have some residual or lingering health issues who do see success when they cut out more carbohydrate or go zero carb, whether an elimination diet is a temporary tool or with a longer term goal in mind, that they see resolution of lingering health things because you just cut every source out. Like you were saying with the seed oils, or there's so many hidden sources. I know we touched on that a little bit last time because you shocked me with the pancake batter thing and the scrambled eggs at the restaurant. And I never looked at diners the same way.
Yep, it's a big deal. And we have to all think what motivates that restaurant owner or what motivates. And so they're not stupid. They're just trying to not go broke. And if they have to put a little pancake batter in the scrambled eggs to make them even more delicious, oh, you can bet they're going to do that. And so at multiple chain breakfast restaurants here in the United States, you have to say, "Do not put pancake batter in my scrambled eggs. I want only scrambled eggs." And the waiter will be like, "Oh, okay. I don't know why you would want that. They don't taste as good, but okay." And it's just like a lot of people don't realize that at Starbucks, coffee places, you have to say "no classic," or they will put a squirt of simple syrup, which is sugar, in your coffee. Even if you just order black coffee, it's such a habit for the baristas to put that squirt of classic in there because it gives it that Starbucks taste. They don't think about it. You have to know that these places do these things and request politely, of course, and respectfully that they don't do that to your food in order to have your best health. And Vanessa, I've had so many hundreds of people either come up to me at a conference or online and say, I had no idea that Starbucks put a squirt of sugar in every cup of coffee unless you said don't do that. I had literally no idea. I was blown away. Why would they do that? And anytime why, the is because they don't want to go broke. They're trying to build an empire, and you have to have amazing tasting coffee to do that. And there's no doubt putting a little squirt of sugar in your coffee makes it taste better. No doubt about it. Just like for an alcoholic, putting a little shot of vodka in your coffee makes that coffee way down better.
Yeah, I mean, it answers the question, why can't I make my scrambled eggs taste that good at home, or my coffee, have that sort of taste? Because it's not the same thing. They're adding stuff to it.
Right.
So it's important, I'm glad that you talk about those things, because it is important. So if someone is having some kind of lingering health issue or having dry skin, in your opinion, it's usually because there's something that hasn't been addressed. If someone has hair loss, when you see that kind of question, eating the proper human diet, is that sometimes protein related, or what do you usually see with that?
Yeah, and so every time you have some weird side effect from eating the proper human diet, it means that person has brought something from their old way of eating or their old lifestyle with them to keto. Okay, and so hair loss thing. Every person on the planet currently alive who, if you said, "Hey, if you're overweight, what should you do to lose weight?" Immediately, they're going to make the universal symbol of eating a smaller portion size. If you want to reduce your weight, your fat level, you got to reduce what you eat. And that's been beat into us by every Weight Watchers commercial, every episode of The Biggest Loser. Everybody knows if you want to lose weight, which what we really mean by that is you want to lose fat, then you've got to reduce your portion size. You've got to restrict your calorie intake. That's how it's done, even though that's completely wrong and backwards. And so many people, when they start eating a keto diet, and I put air quotes around that, when you say the word diet, subconsciously, they're like immediately, okay, I'm just going to eat half of a ribeye. I'm only going to eat 4 ounces of fish. I'm only going to just eat this little amount. And if you're not getting enough protein or enough nutrition overall, one of the first ways that you'll start to see that in the human body is with hair loss and with skin issues, because the skins are replaced very rapidly. It only takes about 3 months for you to replace every cell in your skin. And so if you're not eating enough protein or just not eating enough nutrition overall, you'll start to have skin, hair, and fingernail and toenail problems. And one of the ways, the quickest way that manifests is with hair loss. And so see this in women. And it's because women were taught by their mom, if you're trying to lose weight, you got to cut your portion size. And so they're unconsciously calorie and portion and protein restricting. Even though you tell them blatantly you don't have to restrict portion size, they'll still do it anyway if they're not very consciously aware of what they're doing.
That's a great answer. Now, I want to ask your opinion about eating 7 to 10 cups of green vegetables per day. And I saw a video that you did about this, because there is a message out there that if you don't eat 7 to 10 cups of green vegetables a day, you will get fatty liver on a keto diet, or you will not get enough potassium. So I'd love to hear your opinion on that.
Yeah, and this is put out there by a guru and his followers. And I don't like to name names, but let's just suffice it to say that there's a person with a large following in the ketogenic space who has said on videos that the ketogenic way of eating will give you fatty liver. And the way to keep giving you fatty liver is to eat 7 to 10 cups of vegetables every single day to protect your liver from all of the fatty meat that you're going to be eating on keto. Now, obviously, this is in the face of everything you and I have been talking about previously. Eating lots of fatty meat plus or minus a little bit of veg is the proper human diet. That will not give you fatty liver. In fact, there's no diet on the planet that reverses fatty liver quicker than a ketogenic diet or a low-carb diet. That is the cure for fatty liver, is to cut the carbs out of your diet. And so then to pretend that you have to put back in 7 to 10 cups a day of carbohydrate-rich vegetables in order to protect your liver from the carbohydrates that cause the fatty liver to start with, you can see how that just quickly becomes a silly circular argument. It's just, not sure. I think it just comes from a poor understanding of what the proper human diet is. And so, no, no one has to eat any vegetables, as a matter of fact, in order to have a very healthy lifestyle and a healthy diet. If you like vegetables and you want to include them in your ketogenic way of eating, I think that's also appropriate. And I posted on my Instagram account, probably been a year now, that there's really a spectrum of the ketogenic way of eating. Some people do great as an ovo-lacto pescatarian, eating tons of green vegetables, some eggs, some fish, and they do great with that, and then some cheese. Other people do great on a 100% fatty meat carnivore diet. And I think that is the spectrum where the proper human diet lies. And each of us individually has to find where we fall on that ketogenic spectrum. I personally think that no one is going to be their best self on a vegetable heavy diet, but some people feel great on veggie heavy keto, and they do great. And as long as they're adding some cheese and some oysters and some seafood and stuff like that, so that they're getting all of the omega-3s and the essential vitamins and minerals and nutrients, they seem to do very well. I don't know if they'll continue to do well for decades or not on that diet, but currently they seem to be doing fine. So that's why I include that in the ketogenic spectrum of the proper human diet.
Now, this question is one that always makes me smile a little, but people ask often, is it dangerous to stay in a perpetual state of ketosis?
Right.
And
I know
that
that's like asking, is it safe to eat the proper human diet long term? You see how that makes that question? Yeah. And that's why I love that term so much. And so, yeah, there are gurus out there who will say you need to cycle in and out of keto, or it can be dangerous. And I think that this reveals a complete and utter lack of understanding of what the proper human diet is. That would be like saying, "Oh man, you have breathed too much air today. You gotta stop that. You have to have days where you only breathe 10 times a minute all day, or you'll hyper oxygenate and no." Or saying, you need to cycle off drinking water every day. You need to have days where you don't drink any water at all, or you just won't be healthy because you're drinking too much. It's like, what are you talking about? The ketogenic diet. The ketogenic diet. Let me be very clear. Nisha calls it berry method keto. I don't believe in any keto products whatsoever. I don't believe in shakes. I don't believe in powders. I don't believe in bars or cakes or any of that. Your ketogenic diet needs to be made up of meat and animal products and maybe some green veg. That's it. I think that on your birthday you can have a keto cake. I think on your anniversary, if you want to have a keto protein shake, that's fine. But should those things be part of your daily regimen? No, they are not what we are supposed to be eating. That you're still processing the nutrition and you're making it effortless for your body to get this huge hit of nutrition. That's not how our bodies are made. There's actually a dentist out there that thinks that, and I think it makes a lot of sense, that the reason that so many young children and teenagers' jaws are not forming properly, the reason that children have to have their mandible broken and reset and have to basically, a mouth cast for months, if not years, which is what braces are, is because we're eating the proper human diet. Young children need to be gnawing on a bone. They need to be chewing on steak. They need to be chewing up tough foods. And this is his theory, and you can go back and look at the photographs that Weston A. Price took of natives who grew up that way. Their jawline is pristinely perfect. Their teeth are perfect. None of those guys needed braces. But then when you introduce the processed carbohydrates of the standard American diet, one generation later, they're already having tooth overlap and they're having, a mandible that's either sucked in or protruding. Immediately they start to have jaw and face and tooth problems because they're not eating the proper human diet. And I think it literally affects every single part of a human being when you're not feeding your baby or your toddler or your young child the proper human diet. There's going to be consequences for that.
Yeah, and I love how you put it in one of your videos about how, because people talk about how when you're in this state of ketogenesis that you are stressing the body, and you had these analogies about how learning to play the piano is stressful. It's a eustress. It's good stress.
Yeah.
And, there are some, benefits to that.
Yeah, and let me just say very clearly, I don't think that eating a real whole food ketogenic diet is any stress on the human body at all. I think it's the proper human diet.
Right,
Now, transitioning to that diet, there may be some stress there. And I
right.
consider that to be bad stress. The acute stress and acute inflammation is good for us. And a lot of people get this confused. They just hear stress is bad, inflammation is bad. That's actually not true. You have to put the word chronic in front of those. Then you're speaking my language. And so chronic
Right.
stress that you either can't or won't get out of your life, that's going to lead to health problems long term. Chronic inflammation that you either can't or won't get out of your life, that's going to lead to long term health consequences. But when you sprain your ankle, Vanessa, what is the very first thing that happens? It hurts. It swells,
Inflammation.
red, it gets hot. Those are the 4 signs of inflammation. That is acute inflammation. And so in modern medicine, here's another great example of just the ignorance of modern medicine. If you went to the preeminent orthopedic surgeon in the United States of America, I mean at the Mayo Clinic, at UCLA, at Harvard, and you said, "Oh my God, look at my ankle. It's red, it's hot, it's painful, and it's swollen." I said, "What should I do to my ankle?" What would they tell you to do, Vanessa? Put some ice on it, take an anti-inflammatory. They would tell you to literally fight every single part of that inflammation. Here's the problem with that advice. That inflammation is the first step of the healing process. And now that's why so many people have these chronic joint injuries that just never healed properly, is because, the cyclooxygenase pathway that we block with the COX-2 inhibitors, that is a vital part of the inflammatory pathway, which is a vital part of the healing pathway. And so when you go to Harvard, to that orthopedic guy that wrote the book, and you follow his advice and you put ice on your ankle and you wrap your ankle and you take an anti-inflammatory like ibuprofen or Celebrex or Mobic or whatever, you're actually slowing down your healing process. Now, does it make it feel better? Yes. Is that really the goal, is to have an ankle that immediately feels better but takes longer to heal and has an increased risk of winding up being a chronic ankle pain? That's the kind of idiocy we're dealing with in American medicine right now. And that's why I wrote the book, Lies My Doctor Told Me, is because I'm sick and tired of people saying, yeah, my ankle just never healed right. I sprained it really bad one time and it just never healed. I'm probably going to have surgery. No, the reason it didn't heal is because you interrupted the healing process by the ignorant advice that orthopedic surgeon from Harvard gave you.
It's so funny you said that because I just had my wisdom teeth taken out and I was trying so hard to resist icing it and taking anti-inflammatories for it because I was like, I know my mouth is trying to heal.
That's right. You're exactly right. Yeah. And sometimes the pain is so severe that we can't. We have to take it.
It was.
Yeah, sometimes that's life. Sometimes it happens to you and you just have to deal with it. But if you're having minor inflammation, for you like sprained your ankle just a little, or you had a cavity filled, or you had some minor procedure, do not take an anti-inflammatory. If you have just a little bit of a headache today, do not take thoughtlessly an over-the-counter anti-inflammatory for that. You're setting yourself up for long-term pain, stiffness, chronic disease.
Yeah, I love that. Now, and knowing that you look at this whole framework from sort of an ancestral, way of eating, I'm really curious what your thoughts are on dairy, just because that is kind of excluded from the paleo approach.
Yeah, and so dairy is, let me be just very clear right up front. I don't think any human being as an adult should eat or drink any dairy product. Okay, I think that is less optimal than not. Okay, now with that being said, I eat cheese almost every day. I put butter in my coffee, I put butter on my steak. I use those every day. And let me tell you how I rationalize that in my mind. Only human beings drink the milk of another species. There is no other species of animal that does that. If milk were the awesome source of nutrition that we've been taught all our life, there would be a weasel or a bird or some kind of a rodent that would have learned a strategy to steal this nutrition from other mammals. They would sneak in, like a weasel would sneak in and pretend to be a baby pig so it could suck at the teat of a sow who's had babies. There would be some example of that in nature, but there is literally no example of a mammal sneaking in and stealing the breast milk of another mammal. Only human beings do that. Now, is drinking lots of milk an excellent way not to starve to death? Absolutely. If you're starving, drink milk. I promise you won't starve. If you want to gain fat as quickly as you possibly can, drink lots of milk. It's full of growth hormones. It's full of all kinds of stuff that will make you gain fat. If, however, your goal is to be the healthiest, leanest human being that you can, I would probably not drink liquid milk. The reason that I think butter is fine is because all of the sugar and virtually all of the protein, which can be quite inflammatory, has been removed. All you're eating is the milk fat. And I don't think the fat is a problem for humans. I think we eat that all day long and it doesn't inflame us, or for at least most of us. And it's perfectly fine. Why is cheese okay? Well, what has happened to cheese? Cheese has been acted on, the milk has been acted on by a microbe, which has eaten up all the sugar, correct? That's what the microbe's there for, is sugar. And in the process of eating the sugar, the waste products of the microbe have bent the inflammatory protein molecule, and now it's a different shape. And I think for most people, that makes the protein much less inflammatory than it would be in the liquid milk itself. And that's why I think most people can eat at least some cheese and not really be inflamed or have any problems as long as it's a full fat cheese. I think that's fine for most people. There are some out there, however, who even a full fat real cheese will inflame them unless it's a raw milk cheese. And then even some people, that is inflammatory. For some people, even butter has too much trace protein and trace carbs. They have to eat only clarified butter or ghee. And so I think this is because, we've been advertised to the moon and back that milk is good for you. Every grandmother wanted milk. It's just, it's one of those things that we grew up thinking was normal. And so I think it'll take a generation of humans before we don't consider drinking a glass of milk. One day we'll consider that weird. Like, what the hell's wrong with you? Why would you do that? But now it's going to be a normal option, right?
Yeah, you're not kidding about the marketing. It's definitely been heavily marketed to us. Now, that's really interesting. I do sheep cheese myself, and I tolerate it quite well. But, yeah, not so much chugging the milk like I did when I was a teenager out of the fridge.
Yeah, same goes for me. Back when I played football in high school, I used to drink a gallon of 2% milk every day, thinking that I was doing a tremendous benefit by doing that. And looking back now, I realize all I was doing was causing my severe daily allergies and dandruff by doing that. I wasn't really reaping. I should have been eating lots of fatty meat, a little veg, and then I would have been optimizing my athletic performance.
Yeah, we need to rebrand to Keto Does a Body Good, because
oh my God, yeah, that's beautiful. Please run with that.
A lot more helpful. Now, just for some real quick rapid fire, what's your favorite restaurant keto order?
My favorite restaurant keto order currently is a full rack of dry ribs, onto which I put a lot of salt.
Okay.
And that's my current go-to order if I suspect the restaurant has fairly good ribs.
Awesome. And what's in your mug these days?
So currently, my current keto coffee, because we're never going to say the B word again because it's so confusing to people. My current keto coffee has about a teaspoon of grass-fed butter and a big pinch of Redmond's real salt in each cup. And now if I'm not hungry at all, I won't even put the butter. I only do that if I'm starting to get hungry and I'm trying to extend my fast. But the salt goes in every cup because I know that the diuretic of coffee is going to make me lose some salt. And so I just go ahead and I've come to really love salty coffee. It's really delicious.
Yeah, I do too. I put it in my coffee as well, and I also call it keto coffee, and it's a lot less confusing for sure.
Yeah.
Awesome. Now, what's your sort of overarching goal or intention for the world? And tell us more about your book and, how people can kind of find it, but how does your book kind of play into that, your overall sort of intention for your work that you're doing, your life's work?
Yeah, so I have been called for whatever reason to end the type 2 diabetes epidemic in the United States and the world, and to end the obesity epidemic. There was just a new article published that the rates are even higher now than they were a year ago. And I'm not sure why this is my life mission, but this is my mission, is to break the back of those epidemic curves and make those numbers start to go down again. Because when you've got pediatric endocrinology clinics focusing on nothing but children with type 2 diabetes and fatty liver, there's something bad wrong with that. We are literally through the looking glass into Twilight Zone territory. And currently, every doctor's standing around with his thumb up his butt, acting like we don't know what's causing this. It's multifactorial. You'll hear doctors use that word because it makes them sound really smart, but in reality, we have no damn idea why this is happening. But I think I figured out why it's happening. I think I figured out the root cause. It's the carbohydrates causing chronic insulin spikes and chronic inflammation. That's what's causing virtually all of the chronic disease, the type 2 diabetes, the fatty liver, the obesity in the U.S. and in the world. That's what's causing all of it. And so it's my mission to wake people up, because never is the American Diabetes Association going to hold a press conference and say, guess what, we were wrong, we're idiots. That's never going to happen. And so I've got to reach out to just regular people who have a spouse and a dog and a job and a life and say, hey, step away from the carbohydrates if you want to have a life that makes you feel a little bit like an Avenger. If you want to feel like a god or a superhero, stop eating the carbohydrates, and things will happen in your life and in your health that are almost miraculous. And I really enjoy doing this, but the only way I know to reach people is on social media. And the only way I know to expand my reach beyond my followers is for my followers to share this message. And so I always ask people to share. Please share this, because you can really save someone's life by doing that. But that's where lies my doctor told me came from, is I got sick and tired of doctors just giving patients ignorant medical advice that was based on, number one, no common sense, number two, not ancestrally appropriate, and number three, was based on no meaningful real research. They're just repeating what they heard their professor say. They're not even thinking, and that's not the job of a doctor. If you're not thinking and teaching as a doctor, then you suck, and you should find a new profession.
I just would want to give you a standing ovation for that, because that is just amazing, and it makes me tear up a bit, just because we really need MDs and doctors like you who are brave enough to stand up against sort of conventional wisdom when it comes to taking all the nutritional information out of the equation. And I there's so many family members and friends in my life that have been affected because of poor nutritional advice or lack of nutritional advice. I really thank you so much for the work that you're doing, for being brave, for going out there and spreading the message. As an MD, your word goes so much further, as you all know, than when other people are sharing the information. And it's just, I really want to thank you from the bottom of my heart for all the work that you're doing. And it is such important work.
Well, I appreciate that so much. It really means a lot. And I can promise you this, I won't ever stop. I won't ever slow down as a poor Nisha gets sick and tired of hearing me run my mouth. But that's the only way I know to spread this message. And so I won't ever stop. I won't.
That's awesome. Well, I love your fire and your passion, and I know that people will love your book. Where can people find the book and follow more of your awesome videos and information?
So the book, Lies My Doctor Told Me, Medical Myths That Can Harm Your Health, is available everywhere books are sold, I'm told, by Victory Belt Publishing. That's my publisher. Should be in Barnes & Noble. It should be at all the bookstores. It's definitely on Amazon. Should be on all the Amazons in different countries as well. When I first got into this, I had no idea that there were 8 or 9 different Amazons. I thought there was just Amazon.com. Definitely not true. And so they're available now as the paperback and the Kindle version. And then within the next 2 or 3 months, Carl Franklin from the Two Keto Dudes we'll be reading the Audible version, and then Carl and I will be kind of chatting about what the chapters are about in between each chapter. And so it's going to be I think it's going to be a very fun Audible book that's going to give way more value than if, somebody just read the book and that was it.
Oh, that's fun. And
I do a lot of work on my YouTube channel. I've got over 500,000 subscribers now on YouTube, which still blows me away anytime I think about that.
That's amazing.
It's really weird. Yeah, I'm not even sure how that happened. I do a lot of I'm honest, I have no idea how that happened. I do all my snarky, salty work on Twitter. So if you want to see me slapping around multinational, multi-billion-dollar corporations, I do that on Twitter. If you want a more loving, helpful message, that's Instagram and Facebook. And then if you want just informational videos with maybe a little humor or snark, that's YouTube. And if you just search Dr. Berry on any of those, you should find me.
Awesome. Well, thank you so much for all the work you do. And we'll look forward to catching up with you at KetoCon. I know people can come and see you speak there. So thank you for all your work and for being here with us today.
My pleasure, Vanessa. I'll talk to you next time.
All right, guys, thank you so much for being here today and tuning in. I would like to invite you to check out the 20-Day Ketogenic Girl Challenge. A lot of the things that we talked about on today's episode, I find are really solved by doing a ketogenic meal plan like the one that I designed, the 20-Day Ketogenic Girl Challenge. And a lot of that comes down to having someone already calculate everything for you, having the macros all dialed in for you, having this meal plan with all the portions already outlined for you. It really helps address a lot of the portion control issues, and having everything calculated already really helps with preparation and doing batch prep. A lot of people on the challenge will pick out a day, say on Saturday or Sunday, and they'll meal prep ahead for the week, and they'll pick 2 or 3 days from the plan that they love, and they'll repeat it, such as day 5, which has the burger with my special keto burger sauce, and repeat that. And you can do that as many times as you like, and it really makes preparation and following keto and the meal plans a lot easier, and doing that batch prepping and meal prep on the weekend. And the meal plans also come with a shopping list. They come with a full guide to testing yourself for ketosis. And the best part is they include my support and coaching in our members Facebook group, which is an awesome community. I love being in there, and it really helps so much having other people doing this program with you and alongside, and people who've done it already and successfully reached their goals there to inspire you and to support you. And having that community built in is so important. Our success rates go way, way up when we're doing any kind of diet or lifestyle change when we have a buddy. And I'm here to be your buddy, to be your guide, and help you with your journey, because you can post any questions that you have about keto, about the meal plans, about low carb, and I am there to answer your questions and to support you as you go. And I just think it makes such a big difference to have a coach and a support group and a supportive community around you. So check out the 20-Day Ketogenic Girl Challenge. Just a word of caution, there is another 20-day keto challenge that's being sold. It is not mine. I only sell my program from ketogenicgirl.com. So if you see a link to that, it's a copycat version that has kind of popped up in the last year. It also has a similar name, 20-Day Ketogenic Challenge. But if you are looking for my program, which comes with my support and coaching, you can only get it from ketogenicgirl.com, and make sure that you are purchasing the one from me, because I have some people who have purchased this other program thinking that it's my program, and the coaching and support is not included because it's not the program that I formulated and that has had so much success. If you want to read and check out some of the success stories, you can go to ketogenicgirl.com and click on testimonials and reviews or success stories, and you can read some of the dozens and dozens of success stories of people who have done the challenge. And if you join the program, you'll get to interact with so many of those people in the group who've had real success and are there to share tips and tricks for making all of this so much easier and so much fun. So check out the 20-day Ketogenic Girl Challenge at ketogenicgirl.com. And until the next episode, I hope you have a fat-filled rest of your day. A few disclaimers. By listening to this podcast, you agree not to use this podcast as medical advice, as I am not a qualified healthcare provider. The information presented on this podcast is for educational purposes only. Ketogenic Girl is not qualified to provide medical advice. Consult your own physician for any medical issues that you may be having. This entire disclaimer also applies to any guests or contributors to this podcast. Prior to beginning a ketogenic diet, you should undergo a full health screening with your physician to confirm that a keto diet is suitable for you and to rule out any conditions or contraindications that may pose risk or that are incompatible with the ketogenic diet. A keto diet may or may not be appropriate for you if you have any kind of health condition, whether known to you or unknown, so you must consult your physician to find this out. Anyone under the age of 18 should consult with their physician and their parents or legal guardian.